The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. It must be Friday. And indeed it is. We're coming at you live from the Scottsdale Money Radio studios here in the Air Park. And you can find us at 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. And how do we do this? Not by listening to me, but by listening to these extraordinary guests I bring to the show. And I am very pleased to have in the studio a return guest. He has not donned my studio for 6 years, and I'll take complete responsibility for that. It's hard to believe that. He actually looks a lot younger than he used to. I think he's living a great life. I want to introduce
our... borrow my glasses, Bob?
No, I don't need glasses. I got my contacts in. But I want to introduce our listeners to Dr. Gary Grove. Dr. Grove.
Good afternoon.
Good afternoon. Can I call you Gary?
You always have.
I know. Well, I want to be formal and ask here on the air if I can call you Gary.
No problem. As my mom used to say, you can call me whatever you want, just don't call me late for dinner.
There you go. Well, Gary is a private practice psychiatrist. He also is on the faculty at Mayo Clinic School of Medicine, and you have a long list of other certifications and licenses that you have, but you're also my dear friend. So it's so good to have you back here in the studio with me.
Good to be back, Bob.
Well, we've had a lot of things happen in 6 years.
We've had a lot happen in the last 2 years and the last week.
Yeah, we certainly have. So I'll dial it back just a little bit on you personally. You got married.
I did.
And you've got a beautiful wife, and I follow you sometimes on social media, and you're also a grandfather how many times over?
12.
12. Wow. You are blessed by...
I am.
By having so many offspring, and just it's so wonderful to see.
And I'm able to remember their names and birthdays, but I will not quote them here.
There you go. And do they live here?
No, unfortunately, I have one set lives in Baltimore, and the other lives in Toronto.
There you go.
And when people ask me about how many grandkids I have, I tell them, for those of you keeping score at home, it's now Toronto 7, Baltimore 5.
There you go. Toronto's winning. Very, very good. And you brought up the fact that a lot has happened, and certainly COVID has happened, and we've got a war now going on in Ukraine, and we are dealing with something you and I talked about before the show started, 2 other pandemics. One is near and dear to me, and that is the aging pandemic that our country's really not prepared for, and then the other one's opioids. So I want to really start by really talking about the pandemic, because that is something that has really affected older adults, and social isolation was an issue long before the pandemic, and this just made things worse, especially when we kept everybody locked down.
Yeah, I mean, that was one of the major issues that affected everyone, not just older folks. The virus and the pandemic there are 2 ways that the virus kind of affects people. One is directly. The virus does get into the brain. It goes up through the nasal passages and gets into the brain and can cause things like stroke and seizures and other neurological problems, as well as direct mental health problems, including depression and confusion, et cetera, et cetera.
Brain fog is something they talk about too.
Brain fog has been a major problem, and brain fog is one of the most common long COVID symptoms. Now, if you're older and you have another problem, like if you have dementia or Alzheimer's, you're more prone to the ravages of COVID as well as other things. Isolation can confuse you even more. Why aren't my children here? And it's explained because we can't let them in. The next day, why aren't my children here? So isolation for people who have dementia is worse. Any neurological or chronic medical problem of any kind made people more liable to the ravages of COVID.
Mm-hmm.
An interesting statistic, I was looking the other day, and something like of the people who got COVID, there were only 20% that were 65 and over, approximately. These are round numbers. But of the deaths, there was 80% were 65 and over.
Wow.
This was an illness that really affected elderly people more than younger people, at least the severity.
Right, right.
So that has been a big issue. I mean, there are other viruses, like for example, I don't know if you've heard of RSV, respiratory syncytial virus, and that affects children.
Right.
And that's it's very, very bad for children. Older adults don't do as badly with RSV as children do. COVID affected elderly much worse than it did younger folks, and continues to do so. But over and above the direct manifestations of COVID, there was what you were alluding to, are the other manifestations. There's isolation. If you're prone to depression, you are more prone to depression.
Right.
Anxiety, if you have anxiety, you're more, this flared up anxiety tremendously for a lot of people.
Mm-hmm.
There were other behavioral kinds of things that went on. Domestic violence went very high. You have people who are together, they're frustrated, they're stressed out.
Right.
They may have lost jobs, their money may have been compromised, they're not sure, they're afraid to go to the grocery store. All kinds of stresses increase the stress at home, and so there's increase in domestic violence. Substance use issues increased during the pandemic as well. Again, that's how people dealt with their stresses, their depression, their anxiety, drinking, drugs. So this has been a very, very difficult time for many people, and the elderly and people with illnesses more so than others. On the psychiatric side, interesting, there have been studies that showed that people with serious mental illnesses like schizophrenia, bipolar disorder, those kinds of things, were more susceptible to getting COVID and more liable to get more severe cases if they got it.
Mm. Mm. Well, you talked about the substance abuse, and one that we've talked about here on the show is alcohol, especially with older adults. And older adults, I'm telling you something you already know, doctor, and that is they metabolize alcohol very differently than you or I do.
Well, I'm
not counting myself as an older adult.
I'm an older adult, so I have a geriatric certification, so I tell people I'm a geriatric psychiatrist in both senses of the term.
There you go. You're living it, and you're a doctor.
That's right.
I get it. I totally get it. But I mean, they drink alcohol, and they're taking so many powerful medications, and don't really quite understand the interaction of alcohol and those medications. And invariably, it leads to possibly falls and other things that do happen that put people in the hospital.
Absolutely.
Or die.
And because as we get older, our metabolism slows, we can tolerate less alcohol as we get older.
Right.
So the recommendations for older folks are less than they are for younger folks.
No doubt. No doubt. Well, we just scratched the surface, and certainly COVID is here, and it is not going away. I mean, it's dampened down, if you would, and hopefully someday we'll see it in the rearview mirror. But right now, we always need to be cautious and need to have our guard up. Well, listen, Gary, it's so great to have you in the studio. We've got so much more to cover. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Dr. Gary Grove here in the studio. I just learned he's got 12 grandchildren, and he knows every single one of their names and their birthdays. I'll quiz him in between the break here. Stick around. We got 3 more segments. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and we're in our second segment here. And I have got Dr. Gary Grove here in the studio with me. He is a geriatric psychiatrist, a general psychiatrist. He's also a professor and teacher at Mayo Clinic Hospital. But if you missed our first segment, go out to our website at cypresshomecare.com. Click on the media button. Third button down is radio show, and you'll catch the first segment and many other shows that we've done here for the last 9 years. So, Gary, we're talking in that first segment about the pandemic. And, we're talking about the COVID-19 pandemic and what it's done to our society and our community as a whole. And, I mean, all the things that we're challenged with today, with the exception of what's going on in Ukraine right now, a lot of it stems right from this pandemic. And you have probably seen an uptick in a lot of different mental illnesses and a lot of needs. But the one thing we were talking about at the end of the first segment was really the substance abuse, alcoholism, especially within older adults, and the chance or the risk that they have in terms of drinking alcohol and the interaction with the medications that are taken.
Yes, that's absolutely true. And again, people cope in ways that they know.
Right.
And so people who know that there's alcohol, and maybe it helped take the edge off before, but now all of a sudden the edge is there all the time, or it's increased, and so people are more likely to develop a dependence on it. And that leads to misuse in other ways.
One of the data points you gave was 80% of the deaths were 65 and older, where 65 and older only represented about 20% of the cases. And, I don't have the data point on the number of deaths, too, that are related to people that were obese and had comorbidities. But, one of the things that should be a wake-up call, and I heard David Katz, who is an epidemiologist, I think at NYU University, and he was talking about this should be a wake-up call for people to get in shape, really to start eating better and taking care of themselves. And, I think that there's a real statement in that.
That is absolutely true. I mean, people with obesity were at increased risk of getting COVID and having more complications and even dying from it. Well, obesity has been a major problem for a long time, and it's been growing, as we know, over the years. I deal with folks who are overweight and help them behaviorally, as well as with some medications, lose weight. But basically, people have to decide that it's important for them and their health. And it's very hard because our drives tell us to eat.
Right.
Back in the ancient times when famines happened, you eat when you can. Well, now you eat when you can, and we have an unlimited supply almost for those of us who are fortunate enough. There are still people who do not have enough food, and that's another topic.
Yeah, food insecurities.
Absolutely. Yeah. But for those of us who do, it's a problem. And it's simple. It's eating less and being more active. It's a solution. And every plan and program that you hear about is designed to accomplish those two things, particularly eating less. And some of them work and some of them don't. Some of them are healthier because some of them, they cut down the intake of calories in ways that may not be so healthy.
Right.
But there are a lot of healthy diets out there, and you can go to sources like, I'll give a little plug, mayoclinic.org. You can go to, there are other similar reliable institutions and sources of information.
Right. And I think the thing that we have in front of us, too, is something that a lot of people don't really, are not mindful enough and that is drinking water. And not drinking, all the coffee and teas and sodas and alcohol that people intake. But water is really the source of everything that is about life on this planet and in us.
Yeah, we are mostly water, and so we have to replace it on a regular basis, especially out here in the desert.
Yeah.
But it's true that a lot of people replace their water by taking a lot of calories in with it. What they also take in with it is our diuretics. Alcohol is a diuretic, which means it makes you urinate, so you're losing water. Not necessarily getting totally dehydrated from alcohol alone, but people get dry. You know,
Right.
the old song, How Dry I Am. There's a reason for that.
Or drying out.
Right. Well, that's a different term. And you have it with sodas and sugary, other sugary drinks.
Sure.
So, but it's simple. It's cutting back and on your intake and increasing your output. But cutting back on intake is more important than increasing your output. If you look at calories you burn in exercise, unless you're training for a marathon or a major athlete, you're not going to burn enough calories to compensate for the food you take in and the calories you take in. So you have to cut those down, especially if you're a normal person who isn't that level of athlete.
You know, for me, and I'm more that normal person, weekend warrior, but you know, when I am active, I find myself not consuming as much. It almost suppresses my appetite. I don't know if that's typical of most people, but if I'm working out really hard, I'm thirsty, but I don't feel like I need to eat a whole pizza when I'm done.
You're a lucky man. I mean, that's true for some people.
Right.
I'm not sure what the statistics are on that, but there are a lot of people the other way where they, as they know, they work up a big appetite.
Right.
So they undo the exercise right after. Okay, I worked out. I'm going to go have a big lunch.
You know, you talked about in the first segment about, you know, what the effects of this pandemic were on people that had memory challenges, you know, mainly dementia and Alzheimer's. And, you know, I know you do a lot of work in that area, and you and I have known each other a long time, and you served on the board for the Alzheimer's Association, and you've done a lot of work in this area. You know, there was a breakthrough last year where they announced a new drug, aducanumab.
Aducanumab,
Yeah,
also known as Aduhelm, is the brand name, which is probably easier to say.
Right, and I've had the privilege of having a number of doctors like yourself here in the studio, and while there's been controversy around this drug for a number of different reasons, there is hope because it's the first drug that was approved by the FDA in almost 20 years. And I know that there's others that are out there.
Well, there's a lot of controversy about Aduhelm.
Yeah.
I read the data on it myself because I don't rely on media reports.
Right.
And my take, and this is my take, is that the data on its effectiveness was unconvincing. There were a few studies and they were mixed. One showed maybe a little bit and one showed no benefit. It does tend to get rid of what are called the amyloid plaques somewhat in the brain, but that didn't translate to cognitive benefit. At the same time, you have like a 40% incidence of brain swelling and bleeding. So in my mind, the risks outweigh the potential benefits.
Right.
There's another issue, which is cost. The actual cost for the drug is $29,000 for the treatment. But that doesn't include things like seeing the doctor, having other tests that you need and other professionals to administer it, et cetera, and it was estimated the cost is more like $75,000.
For one treatment?
I'd have to...
Yeah.
It was for either one treatment or a series of treatments. I don't recall that part, but it was a lot of money. I mean, I saw the number and it didn't matter.
Yeah. But in healthcare, I think the biggest challenge as clinicians like yourself are challenged with is so much is driven by insurance companies. Is insurance companies paying for that?
Not that I'm aware of.
Wow.
I haven't prescribed it, so I haven't
Right.
come into that. I do know the FDA approved it, although their advisory committee, I think it was either unanimous or almost unanimously, voted not to approve it. And for some reason, the FDA overruled its advisory committee, which is rare.
Right.
So I don't know what happened behind the scenes. I'm not a conspiracy theorist
No.
by nature, and I'm not sure what the reason was, but that made people take notice of what's going on with this particular drug.
Well, it's interesting because, you know, what you've said concurs with the other docs that have been in the studio. But they did share the sentiment that I did, and that was the fact that it was the first drug that had gotten approved in 18 years, 19 years, and there's hope because there's other clinical trials behind
Well,
it.
there's a lot going on. In fact, I know the Banner Alzheimer's folks are working on a similar med. They have been for several years, called crenazumab, and there are a bunch of other ones there. But unfortunately, ones that have come, to the finish line haven't worked. And Aduhelm is another one in the line of the ones that haven't worked. I think there's a theory about if you take away the plaques, you'll fix the illness, but it's not true. I think we really don't know enough about what the plaques do and where they are in the system. A lot of people think that you have to prevent the plaques from happening. And that's what I know the Banner Alzheimer's folks are doing. They're getting people early who are at risk before they develop the plaques and the tangles. And I guess we have to go.
No, well, we have to go in a minute here, maybe 30 seconds.
Okay.
But I want to just kind of put it and share with our listeners. Literally almost about a year ago, Dr. Eric Ryman sat in your seat.
My old friend.
And you know, he's such a great guy and just such a genius because he is one of the founders of the Banner Alzheimer's Institute. And what he said about tangles and plaques was he said that, you know, we still don't know. And he said, you know, we're of the belief that we have to be able to treat the person maybe as much as 20 years before the plaques and the tangles show up. So, I mean, there's so much they're learning, and every single time they have a clinical trial and it doesn't work, as he says, but we've learned. And that there's just we're making progress. We're not there yet.
I have a story about that when we come back.
All right. Well, it's hard to believe we're at halftime here at Health Futures, taking stock in you. I've got Dr. Gary Grove here in the studio. 2 more segments. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And we're in our second segment here, our second half, should I say. And if you are just tuning in, I got Dr. Gary Grove here in the studio with me. And it's been 6 years since he's done my studio. And we're not going to wait this long next time.
Fine with me.
Yeah, well, listen, it's good to have you. And if you missed the first half, go up to our website at cypresshomecare.com. Click on the media button, third button down is radio show. You'll catch the show and many, many more. So, Gary, we've talked about, you know, COVID. And obviously COVID is something that, you know, we've all been dealing with for the last 2 years. And well, the effects are going to last us a lifetime. I mean, the thing that I worry about, and I know you do, your area of expertise is more in the geriatric side, but I worry about the kids. I worry about, you know, isolating the kids and the masks and not having the social time that they certainly need. And this is stuff that we're not going to see tomorrow or the next day. This is stuff that we'll see in decades from now.
Yeah, I mean, we don't know. We have nothing to compare it with. So we don't know what the isolation, the kids weren't able to go to school. I am very optimistic, though, about the resilience that kids have. I've seen it in my own grandkids. I've seen it in my wife's grandkids. But you'd have to ask the child psychiatrists and the pediatricians what they think in terms of how this is going to affect kids in the future.
Yeah, no, it's something that, you know, we will see. So I kicked off the show by saying that, you know, COVID is the pandemic we all talk about, but there are 2 other pandemics that are really ripping apart our society. One is opioids, and, you know, somehow, you know, that took a backseat to COVID, and rightfully so. I mean, COVID came on really fast and really strong, but opioids have been a problem for us since the 90s. And, you know, we're all seeing a lot of stuff come out now about opioids and how to deal with this pandemic that we're dealing with, and how do we get control of that. And, you know, I know you don't have a ton of experience in this area, but I value you as a psychiatrist. You know, is there really hope? And you and I talked a little bit off the air about some of the treatments that they are finally coming together with.
Well, absolutely, there's hope. There are treatments with Suboxone. There's still the methadone treatment programs can be very effective. There are therapy programs that are very effective. But it's still a big problem. There's no question. I think there was a lot of attention played to the prescription opioids, which are still somewhat of an issue.
Right.
In the elderly population, they're a bigger issue, obviously, than non-prescription opioids. But in terms of the street opioids, where a lot of the overdoses happen, a lot of it's because of illicit ketamine and other substances that are being added to your traditional opioids, like heroin.
Fentanyl.
Well, fentanyl is, I'm sorry, I meant fentanyl, not ketamine.
Yeah, fentanyl.
Fentanyl. And now there are variations of fentanyl that are being cooked up in labs. So it's gone back to the streets because what happened was there was a big outcry about the prescription opioids. So the doctors started retreating from their prescribing practices for the most part. So people went back to the streets to get their drugs.
Right.
So now it's more back on the streets. There's still some issues prescribing, and we have to be very, very careful prescribing opioids. But it's grown up more on the streets than anywhere else nowadays.
And we're seeing a lot of it in the media. I mean, look, there was this recent settlement with J&J and a number of different, I think I would call them distributors like McKesson and Cardinal and others. I mean, we're talking about $26 billion with a B. And I mean, I always wonder, and obviously I'm not expecting you to have the answer to this, is how does that money make it back out into the communities to really be supportive of the families that are dealing with this as well as the individuals themselves?
I have no idea.
Yeah, I know. It's a big number.
I mean, I've seen class action lawsuits, and often the people who benefit the most are the main attorneys and the primary plaintiffs.
Right.
So I don't know how it's distributed.
No, that's okay. That's all right. And I don't want to really go down, too far on that. I wanted to bring that to our listeners' attention. But the other one that I really want to focus the second half on is the aging one, and how do we deal with this? And the area of expertise that we have is really helping people age at home. And one of the things that we did learn with COVID is communal living. It was a very big challenge because a lot of the communal living centers just weren't doing enough to really protect the spread. And look, I've had Karen Barno, who's a dear friend, and she's head of the Arizona Assisted Living Federation, and she said, look, we kind of did it to ourselves 20 plus years ago when we started this, and as we made assisted living the social model, we didn't make it a medical model, and one thing we learned about COVID was it spreads through the air, airborne, and it is highly contagious.
And particularly in sites where there are large groups of people or people in very close quarters. That's where it spread the most. And that's why nursing homes and assisted living facilities and other kinds of group living facilities were hit the hardest, particularly early on, until we figured out this is bad.
Right.
But when I am counseling patients, I share with them all the opportunities and all the choices, and we try to figure out the pros and cons for the individual patient and what's best for them. Is it best for them to stay in the home and get in-home care, which it often is, and we try to do that a lot. But then the time comes when that can't happen anymore. That It's just not working, or the resources aren't there, and so other approaches have to be taken.
Yeah, and you touched upon a part here on the resources. I mean, let's face it, the data shows us that 9 out of 10 65-year-olds or older want to stay at home if they can. And to your point, not everybody can, physically or mentally can. But those that can want to. But resources seem to be the biggest challenge we have. I mean, as a government, we don't pay, and oftentimes I have to disappoint at least half the people that call us wanting care services, thinking that Medicare pays for it, thinking that their supplement might pay for it, or managed care pays for it, or maybe they read something about Medicare Advantage paying for it. And yes, Medicare Advantage is starting to pay for in-home care services, but they're limiting it to per member between 60 to 100 hours a year per member. That's not enough.
That's not enough. And that's also true lack of resources for the group settings.
Right.
Whether it's assisted living or skilled nursing facilities. Most of the time, insurance doesn't cover those either.
It doesn't.
So we're all going down that road. And, it's something that, yeah, I agree with you 100%. It needs to be addressed, that it has to be supported because it can bankrupt people. But you have people, for example, who are living at home where in-home care is great, but then they get to a level where unless you've got 24/7 caregivers or substantial hours of caregiving, it's not going to be sufficient. They're going to be in danger of falling, of leaving the fire on, the stove on,
Yep.
walking out the front door and getting lost, et cetera.
All of those things.
Yeah, so that's when a higher level of care is needed. But for people who are in earlier stages, who are able to function well, whose behavioral symptoms are well controlled, in-home care is great, and it's perfect, and it's preferable in those situations.
No doubt, no doubt. But I mean, we always have to address the money issue, and it's like, how do we do that? And we can talk a little bit about it in the next segment. But I really think that this should be a wake-up call for Americans in terms of long-term care supports. And, for those children of those older adults, they should start thinking about saving money. Maybe long-term care insurance policies, life insurance policies with long-term care blends on it. But we're not ready for this. And when you're talking about 71 million baby boomers that are turning 65 at 10,000 a day, and by the way, last year they started turning 75, and in 9 years they're going to start turning 85. The pressure that they are putting on the long-term care support system it's incredible.
No, you're absolutely correct.
And then talk about that, couple that with the workforce. I mean, we can talk about that. We talked a little bit about that before the show started. So I know the music's going. James is looking at me. Okay, come on, Bob. You're listening to Health Futures, Taking Stock in You. I'm Bob Roth. I've got Dr. Gary Grove here in the studio. We got one more segment, so stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, I've got Dr. Gary Grove in the studio. We got a little Steely Dan taking us into our fourth segment. I did this just for you, Gary.
Thank you.
You're welcome. You're welcome. Hey, listen, if you missed the first three segments, go out to our website at cypresshomecare.com. Click on the media button. Third button down is radio show.
I hope the song Hey 19 wasn't referring to COVID.
No, I don't think that was Hey 19, but...
Oh, was it? I wasn't.
Was it? No. He's going to tell us. What was that, James?
It was Deacon Blue.
Deacon Blues.
Sorry. I only heard the last few bars. Sorry.
No, that's all right. That's all right. So we talked about multiple pandemics. Obviously, we talked about COVID-19. We talked about opioids. We didn't go into a whole lot of detail on that. We talked about the older adult one. And, certainly, having resources. And those resources aren't just financial resources. It's having your village and your people and your, your family to be there to support you is so important as we age. And culturally here in the United States is very different than other cultures where, those cultures that they revere the elderly and they consider it an honor to care for their loved ones. Here, we kind of treat them as disposable, and in the past, we put them in institutions and come to visit them on holidays, and that's really been about it. So we've come a long way. We still have a long way to go. And, I just appreciate you chiming in on it. And, for me, as far as resources, Genworth Financial puts out a cost of care report every single year for 18 years now. And that's kind of our Bible that we look to see what the costs are, what they are and how much they've gone up. And this year alone, between 2020 and 2021, in-home care supportive services as well as assisted living has gone up double digit, close to 15%.
Amazing.
It really is. And to your point, those are all paid privately. If you don't pay for it privately, if you were smart enough to buy a long-term care insurance policy, you have that. Other ways to pay for it is VA benefits, or you have to impoverish yourself and you have to be on Medicaid.
Right, and Medicaid, I don't believe, pays for the in-home health care. It just pays for
They pay for in-home care too. They
Oh, they
pay
do.
for what
Okay.
we call home and community-based service work. We've been a provider for Medicaid here in our state. We call it Access for the last 24, 25 years. And I'm going to tell you that those that are receiving care from caregivers other than family members, nearly, if not more than 50% of those members with those managed care organizations that have been authorized hours to receive care are not receiving them for the very reason that you and I ended the last segment talking about workforce. We are just really having a hard time finding people to work. And the reimbursement from our state is just so way low. I mean, when you're getting less than $20 an hour as a provider of care, and your workforce is demanding 16 or more dollars an hour, the numbers just don't work. You can't make it work. So they're not getting care.
I know
that's
it's
tragic.
it's a tremendous problem, and people who provide very valuable services that everybody expects, like caregivers, teachers, other kinds of
They're so important. these
professions
jobs.
like that, they don't make a living. So if you're sitting in a situation where, okay, what do I want to do with my life, and especially now where, the jobs are in demand, the positions are open.
Mm-hmm.
People are going to choose what's going to bring them more income.
Absolutely. And that's why two things need to happen in my mind. One, we need to figure out how to modernize Medicare and maybe offer a different supportive system to really help pay for this. And two, we need to attract more workers into this workforce. And by modernizing it and finding other supportive systems, if you would, that'll enable us to pay more for it. And we need to introduce caregiving as a profession and professionalize it and offer it in the secondary and primary school systems. If anyone goes into that field, great. If not, you have the soft skills to care for your loved ones as they age.
Well, what's interesting is that what's happening, what you're experiencing in the in-home care market, it's happening, interestingly, in medicine. And that's another effect that COVID had, is that there was tremendous burnout among medical professionals. And so nurses and doctors left the profession in droves.
They did.
They got burned out, and they're gone. And so now there are shortages of nurses, physicians, other medical professionals. So when you are the hospital, there's a chance that you're not going to get the service you expect because there aren't enough staff to provide it.
So
And
true.
that's often not a function of economics, just a function of working conditions.
So true. And there was a point in time about a year ago where I know Banner was turning patients away, and it wasn't that they didn't have the rooms. They just didn't have the staff.
Yeah.
Didn't have the staff. Well, Gary, we have a couple minutes here as we wind down, and I always like to ask my guests, is there a question I haven't asked, or is there something you would like to share with our listeners as we close out the show? So great to have you here. We haven't talked about sports, but if you want to talk about sports, we can talk about sports.
Well, I think, even though, again, I'm not an expert in this, I think that the situation in Ukraine raises a lot of mental health issues because people are being displaced. They're leaving their homes. Systems around them, we talk about a healthcare system here. The healthcare system is breaking down. If you have a medical problem, where do you go? The hospitals are being bombed or closed, or they don't have staff. Over 1 million people have left the country, become refugees. You and I sit here, we don't even imagine what it would be like to be a refugee. But if it happened here and we had to leave and go to some other country, how would that be? So there's a lot of going on, and because of that, there are a lot of mental health complications.
Sure there
a
are.
lot of post-traumatic stress disorder is probably going to be the biggest issue, and it's going to be there for years to come. The Ukrainian health system is going to have to deal with that for many, many years to come. There's also depression, anxiety, substances, all the things we talked about with COVID a little while ago that are going to be a lot worse when and if this thing ends, hopefully soon, please.
But you're talking about the Ukrainians. I wonder what the effect is on Americans that are looking at that and they're thinking, could this happen to us? Or they have loved ones over there and they're worried about them. I mean, just some of the anxiety and the issues that you were just describing are happening right here at home.
Right, and yeah, I'm sure Ukrainian Americans or people with relatives over there are very, very anxious, and if they're prone to anxiety to begin with or prone to depression to begin with, even though they're doing well, things like this can put them over the edge.
What kind of diagnosis would you give to that monster that's causing all this?
Oh, well, we're not, we are ethically prevented from diagnosing public figures. But Monster works.
Monster is tough.
It's not in the DSM, in diagnostic manual that we use.
Right.
But Monster works.
Monster works. Just from what we're hearing, and obviously we rely on the media, it just sounds like that even his own people are somewhat unsteady or uncomfortable with what decisions are being made.
Well, let's hope so, because I think the changes are going to come from within Russia more than anywhere else.
It has to. Gary Grove, so great to see you.
It's been a pleasure, Bob. Thanks for asking me back.
And I did ask you about sports. Suns basketball.
Oh, the Suns are great. And having gone to U of A Medical School, I'm really excited about the Wildcats this year.
Yeah, go Cats. Yeah.
Yep.
Listen, great to have you on. You've been listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. Dr. Gary Grove, my good friend and psychiatrist, thank you for donning my studio. And we won't wait 6 years next time.
Absolutely. My pleasure.
Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3.